We have examined communication in healthcare settings. With this video, we will shift gears and move to public health communications. Most public health communication efforts have taken the form of media health campaigns. This video is organized around 6 questions that we will examine in turn. First, what is a health communication campaign? Second, what is the history of the communication campaign in America? Third, do campaigns work? Fourth, what factors increase the effectiveness of campaigns? Fifth, how are campaigns developed and evaluated? And finally, how will newer technologies alter the campaign process? We will move toward a definition of the health communication campaign by first defining the term campaign. A campaign is a systematic course of aggressive activities for some specific purpose. There are 3 terms here that can be easily lost. The first is systematic, which means done or acting according to a fixed plan or system, methodical. Campaigns must be planned. The second term is course, defined as a path to be taken. Our strategic campaign plan defines that path. The campaign must be rolled out in a series of steps along that path. The third term is aggressive, which means here making an all-out effort to win or succeed. Campaign planners have to be aggressive because campaigns are launched in media and social environments in which there are many competing messages, a matter that we discussed in an earlier video. For example, a campaign promoting non-drinking of alcohol to teens has to compete with television programs and movies showing cool youth drinking. We are now able to define health communication campaign. A health communication campaign is a campaign that uses an organized set of planned communication activities to generate specific health outcomes in a large number of individuals and in a specified period of time. Campaigns are organized, or planned if you prefer. They are designed to produce specific health outcomes, usually changes in health relevant behavior. They target large audiences. They have a beginning and an end. The primary communication activities include the design of messages and the distribution of those messages through channels of communication such as television, radio, print, face-to-face encounters, billboards, and the internet. Health campaigns have been with us for a long time. The first health campaign in what is now America dates back to 1721. Reverend Cotton Mather and 2 of his colleagues promoted smallpox vaccination. This was an era in which many people were dying from smallpox. It was discovered that if you give a person a small dose of the virus taken from a dead or dying person, they could be inoculated against smallpox. This was a risky procedure, however. The virus was live, not deactivated, as is the case with modern vaccines. For this reason, there was strong opposition to Reverend Mather and his colleagues' pro-vaccination stance. These men used pamphlets, speeches from the pulpit, and other means to get their arguments out to the public. Our third question was, do campaigns work? Most modern campaigns are evaluated for their impact. A recent review of these evaluations found that, on average, the behaviors of about 8% of people are affected. That may not seem like much, but an 8% improvement for some behaviors could save thousands of lives. The same review found stronger campaign effects when the campaign is backed up by law enforcement. An example would be a campaign that encourages you to use seatbelts. There are laws that say you must and fines that can be levied if you don't. Campaigns researcher Seth Knorr identified campaign factors that increase the effectiveness of campaigns, which was our 4th broad question for this video. The first thing campaign developers can do is conduct formative research before developing the campaign. We introduced this topic in the video on audience analysis. Formative research allows us to understand our audience. Second, Knorr tells us that our campaign should be grounded in theory. In particular, theory provides guidance on how to design messages. Third, we should segment our audience into smaller, more homogeneous audiences that can be targeted with messages that are uniquely designed for them. Fourth, we need to use a targeted message design approach. This is why we segment audiences. A one-message-fits-all approach will not work. We need to target each homogeneous audience with messages that are uniquely designed and strongly relevant to them. Fifth, those messages need to be distributed to the members of the audience segment through widely viewed channels. We deliver our messages to each segment using the channels they use for their news and entertainment. We learn about those channels through formative research. Sixth, we will conduct process evaluation while the campaign is ongoing. We will use research to determine if our messages are being delivered, if they are reaching intended audiences, and how the audience is responding to those messages. This information will allow us to make adjustments while the campaign is still running. Finally, at the conclusion of the campaign, we need to conduct evaluation research. Evaluation research is sometimes called outcome evaluation. We might, for example, measure knowledge, attitudes, beliefs, behaviors, and other outcomes in the target audience before and after the campaign. The fifth question I posed at the beginning of this video was, how are campaigns developed and evaluated? Noor answers this question by putting his principles into a model that he calls the ACME framework for health communication campaigns. A stands for audience. C represents channel of communication. M is for message. E is for evaluation. This is the basic model. We see that the messages are communicated through channels based on audience segmentation. The model also points to three kinds of evaluation research: formative, process, and outcome evaluation. We will move through this model to see how we could use it when designing and evaluating a campaign. The first thing we would want to do is carry out formative research, which I've already defined and discussed in an earlier lesson. You will recall that formative research often uses focus groups and surveys of the target audience. We will want to know about relevant audience attitudes, beliefs, values, and behaviors, as well as their channels of communication preferences and general media use. We will also ask questions about factors that could facilitate or get in the way of them adopting the behaviors we will be promoting. This research allows us to figure out where the natural groups of like-minded people are within the larger target audience. We will then segment based on this information we learn in our formative research. At this point, we will devise our message strategies. We will develop messages based on theories that are targeted to each audience segment. These target messages will be delivered to each audience segment based on information we have learned about their channel preferences. Younger people might see a public service announcement designed for them on MTV. Older people might see a different public service announcements delivered on cable channels such as the History Channel. While all of this is going on, we will be conducting process evaluation research. We could evaluate the process of the campaign by doing periodic surveys while the campaign is running. For example, we would want to know if our messages are being aired, seen by the target audience, understood, and liked. This process evaluation research will allow us to make mid-course corrections. As the campaign ends, we will conduct evaluation research to see if it was effective. Did it change people's attitudes, values, beliefs, and behaviors? We can do surveys to find out. We might be able to find other more objective measures of impact as well. For example, evaluators of a campaign discouraging driving under the influence of alcohol could look at trends in DUI arrests in the communities targeted. A campaign about safer sex could look at condom sales. What I've described up to this point is the traditional health communication campaign with its heavy reliance on traditional media. This brings us to the final question I posed at the outset, which was, how are campaigns taking advantage of new technologies? Technology will fundamentally change the campaign process in the years to come. New technologies are affecting every aspect of healthcare and public health. The impacts are so profound, in fact, that we often speak of an e-health revolution. Some of the e-health channels now available to us include the internet, with its many online information resources and support forums, computer kiosks that allow you to get information on a specific topic suited to your needs, the electronic medical record, which allows you to look up your medical records, contact your doctor, and chat with an advice nurse, and serious games, which are video games intended to both entertain and educate about health. Many of these technologies are interactive. This means that the communication is two-way. You communicate and the technology responds. Very much related to the interactivity is the concept message tailoring. In message tailoring, software-driven questions are asked of you to learn about you. The software then adapts information given to you based on your needs, your level of informativeness, your attitudes, your beliefs, and so forth. Recall that audience segment allows us to deliver different messages to different groups of people. In message tailoring, each person receives a unique message designed to his or her unique situation, values, and information needs.